Medicare can be overwhelming, and if you're not careful, you can make a mistake that ends up costing you thousands of dollars. Or worse, leaves you without the coverage that you need when you need it the most. In today's video, I'm going to walk you through the top 6 mistakes that you can make when getting onto Medicare. I see people make these mistakes all the time, and you can 100% avoid them. Let's jump in. Mistake number 1, moving money around when you're nearing 65. If you're turning 65 soon and thinking about retirement, there's a good chance you're moving money around. Maybe rolling over a 401k, selling investments, or receiving a lump sum. But here's the problem. Doing that without realizing how it affects your Medicare premiums can be a costly mistake. Because when your income spikes, even temporarily, it can trigger something called IRMA, the Income Related Monthly Adjustment Amount. This adds a surcharge to your Part B and your Part D premiums, and it's based off your income from 2 years prior. So let's say you cash out some stock or take a large distribution when you're 64, it could raise your premiums by hundreds of dollars a month once Medicare kicks in at 65. Because I see it time and time again, a financial advisor will make a suggestion for one of their clients, not knowing how Medicare works, and it'll cost the client hundreds of dollars a month because of it. Mistake number 2, picking a Part D plan without checking your prescriptions first. Prescription drug plans, also known as Part D plans, are not one size fits all. This is one of the biggest traps I see people fall into. They just pick the cheapest plan or the one that they had last year without double checking whether it covers their medications. Every Part D plan has a formulary. Basically, it's a list of drugs that specific plan covers, and it changes every year. Now, 2 plans can have completely different pricing for the same medication, and tiers, copays, and pharmacy networks all play a massive role. So if you don't compare your prescriptions to the plan's formulary, you might end up paying hundreds or even thousands of dollars more per year. So quick tip, I always suggest to either use Medicare.gov as a plan finder to look up your medications with the current plans in your area, or talk to a licensed broker that can do a full comparison for you, and it doesn't cost anything. Mistake number 3, choosing to not enroll in Part D because you don't take any medications right now. This mistake happens all the time. Someone turns 65 and says, I'm healthy, I don't need a drug plan, I'm not taking any medications. So they skip enrolling into Part D altogether. Now here's the problem with that. Medicare penalizes you if you don't enroll when you're first eligible and don't have credible drug coverage. And that penalty is 1% of the national base premium for every month you delay. And that penalty lasts forever. And not to mention, even if you don't take any medications right now, things can change very fast. A drug plan is like insurance for the unknown, not just the known. So here's a quick tip. Just get the lowest cost plan available just to avoid the penalties and have something in place. It's usually just a few dollars a month, if not free. Mistake number 4, calling in to 1-800 numbers. You've seen the commercials, celebrities talking about free Medicare benefits or giving you $1,500 back on your Social Security check. Sounds great, right? But when you call that 1-800 number, you're often talking to a call center that's not working in your best interest. These agents are typically captive, meaning they can only sell a limited number of plans, often pushing whatever makes them the highest commission. You may not get the full picture of what's available in your area. Or even worse, I've got clients who didn't even realize they were switched out of their current plan until the new one kicked in. So quick tip, work with an independent Medicare broker that you can trust and that represents multiple companies. You'll get unbiased advice and they'll take the time to understand your needs. Mistake number 5, missing your initial enrollment period. Your initial enrollment period starts 3 months before you turn 65, your 65th birth month, and continues 3 months after you turn 65. If you miss this window, especially if you don't have credible drug coverage, you could be hit with lifetime penalties and delayed coverage. And here's what a lot of people don't understand. Just because you're still working or have employer coverage doesn't mean you're in the clear. Some group plans aren't considered credible by Medicare standards. Mistake number 6, listening to friends or family instead of a Medicare advisor. Look, this is where we need to have an honest conversation. I understand that your friend might mean well, but what worked for them might not work for you. Medicare is incredibly personal. Your medications, your doctors, budget, and health conditions are totally different. I've talked to so many people who said, my neighbor told me to get this plan, or my sister said she loves her Advantage plan, but they didn't check if it covered their doctors or fit their needs. So just a quick tip, always base your Medicare decision off your specific situation, not somebody else's. Now, if you're turning 65 this year and you need help enrolling or looking at the plans in your area, I would be more than happy to assist you. You can call the number on the screen, and I personally will help you look over all the different plans in your area, the medications, the pharmacies, your doctors, everything about your situation, and look at the different plans in your area. And it's 100% free of charge. We're licensed in almost 40 states, and we can help you enroll and take the stress out of retirement. So if that's something that you want to do, call the number on the screen. I'd be more than happy to help you. And as always, thank you so much for watching this video. It means the world. I'll see you next time.